Now, when I came in the hotel today, I was reminded of something that had actually slipped my mind. I spoke at this conference actually exactly 4 years ago in this very hotel, and the title of my topic was my reflections on my first year being involved in the mental health field. And I'd framed that speech on the metaphor of a movie from, I don't even remember now, maybe the 60s, called The Good, the Bad, and the Ugly. And if I recall correctly, I said that the good things, the deeply good things that I had found in my first year at CAMH, working in mental health, were the intensity of the passion for the field that I found in an expert organization, in a specialty organization. And I was extremely excited by the emerging openness to public discourse about mental health. The bad thing that I saw, having come from the general hospital sector, and I had been in that sphere for several decades, and I had a fair amount of insights into how things work. But the bad was that ongoing marginalization of the mental health care field, not just our patients, but also our organizations and also the experts who work in the field. And what I felt to be an insufficient commitment to the sickest people with mental illness, individuals who had complex mental illness and who required both crisis and critical care. The ugly, I thought, was best exemplified by what felt like so much polarization, so much tension within the field. The word versus came up with some regularity, and you would know the verses, the hospital versus the community, the biological versus the psychosocial models, the psychiatry versus the anti-psychiatry, and I felt and still feel that ongoing tension is actually a significant roadblock to bringing mental health into what I think is important, the centrality of mental health. And if you remember, the World Health Organization tagline is, "There is no health without mental health." So things have changed quite a bit over the past 4 years. I personally have changed. I've been changed by the people that we served, by the people that I work with. My own understanding has definitely become more complete and more nuanced. But what hasn't changed, and again, as a physician leader, I say this, is the fact that I deeply believe in the importance of medical leadership in the advancement of any field in healthcare. This is the driver in non-psychiatric healthcare, and I am putting out a priori a call to this group to ensure that whatever model of education goes forward, whatever model of leadership development goes forward, the sine qua non for major transformational change in the mental health care field will be increasing commitment to leadership by our psychiatrists. So I want to actually carry on with this, with my messages by beginning with a passage from a different book that I read this summer. It was called All My Puny Sorrows by a Canadian writer named Miriam Taves. I'm going to guess a fair number of you in the audience have read this, and you'll know that it is a very deeply personal work for the author, whose sister died by suicide, and in the book, the character represented, the narrator, had also her father and her cousin die of suicide. And about halfway through the novel, the character with mental illness is in hospital after a suicide attempt. The narrator, the patient's sister, issues a rant on what her sister needs from the professionals around her. And she clearly demonstrates in passages before and after the rant that the professionals in that environment don't even come close. It's heartbreakingly resonant for me, and here's what she says. She says, imagine a psychiatrist sitting down with a broken human being and saying, I'm here for you. Saying, I'm committed to your care. I want to make you feel better, and I want to return your joy to you. I don't know how I'm going to do that, but I will find out, and I'll apply 100% of my abilities, my training, my compassion, and my curiosity to your health, to your well-being, to your joy. I'm here for you, and I'll work very hard to help you. I promise. If I fail, it's my failure, not yours. I'm the professional. I'm the expert. You're experiencing great pain now, and it's my job, my mission to cure you from your pain. Imagine a doctor saying, I'm absolutely committed to your care. I won't give up on you. So here's my vision for psychiatrists of the future. I envision professionals who are as heartbroken by that passage as I was when I read it. Professionals whose patients feel heard, respected, and valued, and professionals who won't let their patients slip through the cracks. I'm calling for an educational plan that creates psychiatrists who, first of all, are comfortable with and enthusiastic about caring for people who are critically ill or in crisis. In every medical specialty that I know, but psychiatry, caring for the most seriously and acutely ill patients carries the most prestige. So that was a cause of great consternation when I came to CAMH, that wasn't the favored mode by psychiatry. Secondly, psychiatrists who understand that people with complex and chronic mental illness have human and civil rights, including the right to good health care. And psychiatrists who are prepared not only to provide them with that care and supports, but also to actively protect their rights. And third, psychiatrists who are confident in the role of directing and coordinating care for people with that common combination of psychiatric and non-psychiatric illnesses. Psychiatrists who are comfortable and competent to do something as simple as carry out a physical examination on their patients and to understand it as an honor, not a fearful burden, and as something that actually is positive and therapeutic for their patients. Now you might be saying, she's a neurologist, she doesn't understand the special nature of the relationship between psychiatrists and their patients. She doesn't get it, and that may be true on some level, but I tell you that over the past 4 years I've seen and heard firsthand the needs and wants, the hopes and dreams of your patients, of their family members, their friends. And like everybody in this room, there are 0 degrees of separation between me and someone with a significant mental illness. So, the patients, the other thing I would say is that the patients that I care in my specialty, which is epilepsy, have chronic illnesses too. I'm going to guess that about half of them have a mental illness diagnosis, a developmental abnormality, or a brain injury. I've counseled many of them for decades. I've been in this business for over 30 years. Many of them are very difficult people. But nothing bad has happened in that relationship that I have with my patients. And in fact, I've personally been enriched by our interactions. The relationships have been not only therapeutic, but they've been really generative. I have a number of patients who live in the area of CAMH who are our patients, and they're now articulate champions for both me and for CAMH. So to summarize, I'm looking for that future, that future of psychiatry that has a focus on doctors who are committed to mental health critical care, committed to advocacy for patient rights, both human and civil, and the advancement of mental health, and psychiatrists who are committed to integration of psychiatric and non-psychiatric care. Thanks.